Kolbi Morley says for almost 2 decades, she was ignored by doctors.
Honestly, it goes back to being like 14 and having a lot of pain and going to the emergency room and no one ever knowing what's wrong with me and being told it's in my head, it's stress.
It wasn't until last year the now 33-year-old was diagnosed with endometriosis, a condition where tissue similar to that found in the uterine lining grows outside of it, causing extreme pelvic pain, soreness during sex, heavy menstrual bleeding, cramping, and even infertility.
There are common symptoms, but it affects everybody so individually that it really is, I think, part of why it is such a challenging disease to understand and to help treat.
In Canada, diagnosis delays have become an unfortunate norm, ranging from 5 to 20 years, a cost that rings in at almost $2 billion annually in doctor's appointments, hospital visits, transportation, and even missed work or school.
It's a very multifaceted problem, so that it starts with, first of all, not being able to even discuss women's health issues, issues around period pain, and the difficulties around understanding chronic pelvic pain in general.
In 2020, the U.S. doubled annual federal research funding for endometriosis. And 2 years before that, the Australian government published its plan to increase awareness, education, and management of the chronic disease. But when asked, Health Minister Jean-Yves Duclos wouldn't commit to immediate action here.
We would certainly want to continue listening to the patient groups, the researchers, to see how we can strengthen even more both our investments and the outcomes for patients.
A private member's motion calling for improved access to care and education was proposed in March. It hasn't yielded results. Morley had laparoscopic surgery in February to confirm her diagnosis. Still suffering, she says she won't be waiting on Ottawa.
I'll do anything to get my quality of life back.
Willing to seek treatment outside Canada, paying for the relief she should be able to access at home for free. Jamie Mauracher, Global News, Toronto.